premature babies need varying degrees of medical intensive care after birth to sustain life until reasonable maturity is obtained. All of the babies here have spent varying, duration of time, varying levels of treatment in the neonatal intensive care unit. Next slide. So a small premature baby, next slide. We know they have immature lungs. Almost all the babies here would have got some form of respiratory support, oxygen or CPAP or full ventilation. Next slide. And we know that these babies have difficulty feeding for a long time, right? Feeding is the most natural thing for a term baby. You don't even talk about it. You don't think about it. It just happens. But you all know how much struggle your babies have gone to build up feeds and to take feeds. Feeding, which is so natural and easy, right, is something so difficult for a premature baby. Next slide. Of course, we have to protect them from infections because they have a very weak immune system. Next slide. So if you just look at this, you may all recall such pictures in the NICU. And data has shown this very shocking point. Actually, it is more intense, the amount of technology or labor involved or the finances involved to treat a small premature baby than it is to treat an adult with cancer needing bone marrow transplant or an open heart surgery, etc. So the technology, the finance, everything, it is so intense. And so with such a huge epidemic of prematurity and the huge costs involved, we have to be more aggressive in addressing, preventing and treating this problem. Next slide. And one thing that I want to stress is late prematurity is also a major problem. Sometimes people want their babies delivered at 35, 36 weeks. They come and request the doctors. But just look at the brain of a 35-weeker compared to a 40-weeker. There. This graph from the WHO. A 35-weeker's brain, you can see it's still growing. It's more like a potato. And the 38-weeker's brain is like a cauliflower. You can see that. So the organs are still growing till term. Okay, so as far as possible, we should try to deliver at term unless the fetus is at risk. Next slide. So this is a very important slide. Why this World Prematurity Day? According to me, this is a very important reason why we need World Prematurity Day. Most of the brain protective treatment should happen in the first hour of life. That's called as the golden hour. Okay, whether it is initiating kangaroo mother care early, respiratory support early, shifting the baby to the NICU, everything needs to happen within 1 hour to get the best long-term outcomes. Okay. And here you will find some startling data that I am presenting later, that 1 hour should be used carefully. Next slide. That 1 hour, the first hour can often be underutilized. We did a survey of more than 1,000 women and we found that only 20% of them have ever heard of the term prematurity. I am sure none of you knew about prematurity, right, till you delivered a premature baby. If you agree with me, shout yes. Yes, see, till you delivered a premature baby, you have never heard that word. You never knew that there's something called prematurity. All of us know there's something called diabetes, there's something called cancer, there's something called heart attack. But this is something nobody knew. So what happens is, if you're delivering in a hospital that doesn't have an NICU, you're so shocked by the delivery that, it takes you some time to make a decision. First, the patient is in denial mode. Then they don't know what to do. They wonder where to go. They wonder whether their baby really needs treatment. That 1 hour is lost in decision making. So when we did a survey of more than 1,000 women who delivered prematurely, we found up to 33% of them did not have the knowledge or the logistics. They were not prepared financially or physically or whatever reason to start NICU care fast. And because of this lack of awareness amongst the public, that golden hour was wasted in overcoming shock, denial, and making decisions. Which is why we try to celebrate this day as an awareness day as much as possible, so that if the public is aware, if you're aware that this could happen to you during pregnancy, don't look at it as a bad omen or like somebody talking negatively. It could happen and you have to be prepared for it for the best outcome for the baby. Next slide. Next slide. Okay, so in addition, next. Then in addition to this, premature babies, if they are not optimally cared for in the newborn period, they can have long-term problems, either neurodevelopment or growth, etc. If they are treated adequately in the newborn period and in infancy, these problems can be avoided. Next slide. So as we save more and more smaller babies, we are also looking at their quality of life later, especially their brain development, their optimal cognitive potential, etc. And to do this cost effectively, innovatively in the Indian scenario is a challenge on which we are all working. Next slide. Traditionally, we know there are some things that can promote the baby's development, like early kangaroo mother care. Okay, early skin-to-skin contact is the theme of the World Prematurity Day this year. Then things like nesting in the NICU, tender loving care, massages, etc. Next slide. But we need more of it. Next. For example, one thing that we all, as I already mentioned, is all your babies had difficulty in feeding, right? How many of you think you spent extra days in the NICU because your baby was not able to feed well? Can you shout yes? Okay, lot of you have experienced this, okay, that feeding is an issue. So more and more research is needed on how to optimize feeding skills in these babies. And we have also been doing some research, and I'll be presenting it later to the media. We found that, new oral motor intervention techniques improve feeding skills, and in the Indian context, it cuts and shortens hospital stay. It is very economically viable for a country like India. It reduces complications, and most importantly, we found that when we do some brain and speech exercises to the babies, they also have better IQ, better cognition at 6 months and 1 year of age. So this research was very much appreciated by the European Society for Pediatric Gastroenterology and Nutrition at Vienna held this year at the annual meeting. Oral motor intervention beginning early, it improves outcomes, both cuts NICU stay as well as better cognitive outcomes later in childhood. More research is needed in this aspect. More awareness is needed to utilize the golden hour better, and more work is needed from neonatologists so that premature babies have an optimal outcome later. Next slide. And today's chief guest, I have great, we want everybody to spread the awareness on prematurity. I'm very happy to welcome both our beloved Dr. Surya Kala, who has done a lot of work in obstetrics, and who is the biggest proponent that, late prematurity should be avoided if it can be avoided. Deepika Pallikal Karthik, we all know. I know some of the audience, we kept it as a suspense who is the chief guest today. And then when we told it's Deepika Pallikal, wow, that was the reaction. We all know she's a very famous squash player. She has made it, she's amongst the top 10 in the world. We know she's an Arjuna awardee, Padma Shri awardee and all that. But this is, when I was reading about her, this is what really struck me. The quint, there was an article called Motherhood or Medals. And there, it has said that about Deepika, not every woman has the courage. I'm quoting it as it was stated in the quint. Not every woman has the courage one of India's greatest squash players has shown repeatedly in her life. We would love to be hearing from her after the other sessions. Next slide. And we need all your help to raise an awareness on prematurity. But most importantly, the parents who delivered preterm have to take the message across. The media has to take it across. Celebrities have to help us. And we also have to keep training doctors. Okay. So in this awareness, I think one very important thing is patients telling their experiences to others. So the next part of the discussion I will go through is we will be calling some patients to share their experiences. Okay. The first one is, just tell me, Mrs. Anusha. That's fine. Mrs. Anusha. Anusha, you can bring your sons also to the stage. What I really liked about Anusha is, she has got 2 teenage boys who are in Tamil Nadu cricket team, state, under 16, they are bowlers. And what I really liked about Anusha is, I asked her, can you please tell me, I cannot take the discharge summary out, can you please tell me what was the weight, and gestation of your baby at birth. She said, "Oh doctor, I forgot they were premature." So to me, that's the biggest compliment I got for this world. She said, "Oh God, I completely forgot that they were premature, that they were in the NICU." I would like Anusha to just share a few words for a few minutes about her experiences.
அவன் பிறக்கும்போது 980 அவ்வளோதான் இருந்தான் அவன் வெயிட்டு. ஒவ்வொரு நாள் நான் மேம் பார்த்துட்டு அவங்க இந்த டிரான்ஸ்பரண்டாக சொல்லிடுவாங்க, இதுதான் பையனோட கண்டிஷன் அப்படின்னு சொல்லிடுவாங்க, ஸ்ட்ரைட்டாகவே சொல்லிடுவாங்க. அப்போ எனக்கு கஷ்டமாக இருக்கும், இன்றைக்கி என் பையன் நல்லா இருப்பானா, நாளைக்கு இருப்பானா, அந்த மாதிரி நினச்சிட்டு தான் நான் ஒவ்வொரு நாளும் போவேன். ஆனால் மேம் இதுதான் கண்டிஷன்மா, இப்படி தான் அப்படின்ட்டுருவாங்க. அப்புறம் ரொம்ப கஷ்டப்பட்டு மேம் என் பையனை காப்பாற்றுறதுக்கு எனக்கு உண்மையிலே மேம் நான் உங்களுக்கு ரொம்ப கடமைப்பட்டிருக்கேன் மேம்.
என்னன்னா இந்த கேஸ்ல ரொம்ப சேலஞ்சிங் என்னன்னா மதுர் வாஸ் அ ட்வின் ஆக்சுவலா. The other twin வந்து லைக் in a few weeks of pregnancy உள்ளே இதுவாயிடுச்சு. அப்போ வந்து அந்த மாதிரி ஸ்டேஜில் அந்த ப்ரெக்னன்சியை கண்டினியூ பண்ணுறதும் ஒரு ரிஸ்க் தான். பட் இன்னொரு ட்வின் கிடைக்கணும், ஏன்னா she went through a lot to conceive in the first place. ஸோ யூஸ்வலாக அந்த மாதிரி இருக்கும்போது வேரியிங் அப்ரோச்சஸ் இருக்கும். ஒரு ட்வின் யூட்ரஸ்குள்ளே ஒரு இதுவாகிடுச்சு, அந்த பாப்பா வந்து போயிடுச்சுங்கிற போது இன்னொரு பாப்பா அதை கண்டினியூ பண்ணுறதுங்கிறதே மதருக்கு சைக்கலாஜிக்கலி இட்ஸ் வெரி வெரி ஸ்ட்ரெஸ்ஃபுல். And the baby also suffers a lot. That's what made this case more challenging. Thank you, Jay Shankari, for yeah. Thank you, Jay.
மேம் காண்டி நான் டெய்லி என் பையனுக்கு ப்ரே பண்ணும்போது மேமுக்கும் நான் ப்ரே பண்ணுவேன். ஏன்னா என்னை மாதிரி எவ்வளவோ பேரண்ட்ஸ் வந்து மேமை நம்பி இருக்காங்க.